Trauma can have a profound and lasting impact on the brain, especially when experienced in childhood. It doesn't just affect emotions, it reshapes how the brain functions at a structural and chemical level. Here's a breakdown of the key brain regions affected. Amygdala. This is the brain's alarm system. After trauma, it becomes hyperactive, constantly scanning for danger, even when none exists. This can lead to heightened anxiety, irritability, and emotional reactivity. Hippocampus, responsible for memory and learning, the hippocampus may shrink or function less effectively. This can cause fragmented memories, flashbacks, or difficulty distinguishing past from present. Prefrontal cortex, this area helps with reasoning, impulse control, and emotional regulation. Trauma can cause it to become underactive, making it harder to calm down, make decisions, or feel in control. Neuroinflammation, especially in childhood trauma, the brain's immune system can become chronically activated. This inflammation may increase the risk of mental health conditions like depression, anxiety, or bipolar disorder later in life. Survival mode, the brain may get stuck in a constant state of fight, flight, freeze, or fawn, even when the threat is long gone. This is often seen in PTSD, where the nervous system struggles to return to a calm baseline. The good news? The brain is plastic, it can change. With the proper support, such as trauma-informed therapy, mindfulness, or creative interventions like art therapy, healing is possible. The amygdala is like the brain's emotional smoke detector, small, almond-shaped, and incredibly powerful. It plays a central role in how we perceive and respond to emotional stimuli, especially fear and threat. Here's how it functions, particularly in the context of trauma. Threat detection. The amygdala rapidly processes sensory input to detect danger, often before we're even consciously aware of it. This is thanks to the thalamo-amygdala pathway, which allows it to bypass slower, rational processing in the cortex. Emotional memory encoding. During traumatic events, the amygdala helps encode emotional memories, especially those tied to fear. These memories can become deeply ingrained and easily triggered later, even by subtle cues. Hypervigilance and overactivation. In trauma survivors, the amygdala can become hypersensitive, leading to chronic hypervigilance. Everyday situations may be misinterpreted as threats, resulting in anxiety, panic, or emotional outbursts. Physiological response. Once activated, the amygdala signals the hypothalamus to release stress hormones like cortisol and adrenaline. This prepares the body for fight, flight, freeze, or fawn responses. Disrupted regulation. Normally, the prefrontal cortex helps regulate the amygdala's responses. But trauma can weaken this connection, making it harder to talk yourself down from fear or stress reactions. In essence, the amygdala is trying to protect us, but after trauma, it can become like an overzealous guard dog, barking at every shadow. The good news is that with trauma-informed care, mindfulness, and creative therapies like art or somatic work, we can help retrain the brain's alarm system. Here are some real-world examples that illustrate how trauma can activate the amygdala and shape emotional and behavioral responses. Brain emoji. Examples of trauma and amygdala responses. 1. Car accident survivor trigger, hearing screeching tires or sirens. Amygdala response, interprets the sound as a threat, triggering a fight or flight response, racing heart, shallow breathing, and panic, even if the person is safe. Why? The amygdala has linked that sound to danger and overrides rational thought. 2. Childhood neglect trigger, being ignored or excluded in a group setting. Amygdala response, feels intense fear or sadness, possibly leading to withdrawal or emotional outbursts. Why? The brain has learned that disconnection equals threat, so the amygdala reacts protectively. 3. Domestic violence survivor trigger, raised voices or sudden movements. Amygdala response, hypervigilance, muscle tension, and a strong urge to flee or freeze. Why? The amygdala is on high alert, scanning for signs of danger even in non-threatening environments. 4. Medical trauma, For example, painful procedures in childhood trigger hospital smells or white coats. Amygdala response, anxiety, nausea, or dissociation. Why? The sensory cues are stored as emotional memories, and the amygdala reactivates them as if the trauma is happening again. 5. Bullying at school trigger, laughter or whispering nearby. Amygdala response interprets it as mockery, leading to shame, anger, or avoidance. Why? The amygdala generalizes past experiences to protect the individual from perceived social threats. These responses are often nonverbal and automatic, which is why trauma-informed approaches are so crucial. They help re-establish safety and rewire the brain's alarm system. Here are more nuanced examples of trauma responses, some of which may not be immediately recognized as trauma-related, especially in children or neurodivergent clients. Tornado emoji. Fight responses example: a child lashes out verbally or physically when asked to complete a task. Why? Their nervous system perceives the request as a threat to autonomy or safety, triggering a defensive stance. Woman running emoji. Flight responses example: a young person constantly leaves the classroom or avoids social situations. Why? Their brain is trying to escape perceived danger, even if the environment appears safe to others. Ice emoji. Freeze responses example: a client goes blank during a session or becomes nonverbal when asked about emotions. Why? The amygdala floods the system with stress signals, and the body shuts down to survive. Handshake emoji. Fawn responses example: a child becomes overly compliant, eager to please, or avoids conflict at all costs. Why? They've learned that appeasing others is the safest way to avoid harm or rejection. Cyclone emoji. Other subtle trauma responses: hyper-independence, refusing help or support because relying on others once led to disappointment or danger. Over-explaining or apologizing, a learned strategy to avoid punishment or emotional harm. People-pleasing, prioritizing others' needs to maintain safety or connection. Emotional numbing, difficulty feeling joy, sadness, or connection, often mistaken for apathy. Somatic symptoms: headaches, stomach aches, or fatigue with no medical explanation, common in children. These responses are adaptive, not bad behavior. They're the nervous system's way of saying, "I'm trying to protect you." Recognizing them through a trauma-informed lens allows us to respond with compassion and curiosity rather than correction.